illiterate people. So I welcome you all to this ceremony of release of this ICMR Neurocognitive Toolbox. Dr. Meenakshi will.
Good morning, everyone. Respected Director General, Task Force members, all investigators from different centers, neurologists, neuropsychologists, friends and colleagues. Now, welcome to today's release of ICMR Neurocognitive Toolbox. Now, as per the Dementia Report 2010, there are about 5.3 million Indians living with dementia, and the numbers are growing. So that is our concern, but the major concern is that only 1 in 10 people with dementia, they are diagnosed in India. And what is the reason for that? The reason there are twofold reasons. One is the lack of awareness among the population, and the second is the lack of a linguistically and culturally appropriate test. So early diagnosis definitely is the key to optimal management of this disease. So we remember this task force being started when Dr. Swarna Aladi, along with other investigators, came to us for undertaking a multi-centric longitudinal study on dementia. So at that time, Professor J.S. Chopra, the internationally well-known neurologist, late Professor J.S. Chopra, actually he said that he emphasized that there is a need for harmonization of neurocognitive test batteries. There are so many test batteries which are running in the country, but these are all regional. They are not, they do not cater to the need of the entire country. So we require a culturally sensitive battery which can enable the researchers to use a standard tool to understand the disease burden and pattern. We have developed this battery in 5 languages, and there are champions in these areas who were chosen for the development process so that sustained and continuous efforts, they can be done in this area. There were many challenges which we faced, which will be discussed by Dr. Swarna Aladi and other investigators. But finally, we realized that the batteries, whichever battery which we are using, whether international or national, they are actually catering to the needs of literate population. The illiterate are left over. The neurocognition, we always say the score is poorer in the illiterate population. So at the end of the day, what we said was that we need this battery is okay, but we finally would have to go for a battery for the illiterate population too, the skilled workers too. So with these words, and now I request Dr. Pandian to say a few words. He's the chairperson of this task force currently.
Thank you, Dr. Meenakshi. Good morning, everyone. Respected Professor Balram Bhargava, Director General ICMR, Dr. R.S. Dhaliwal, Dr. Meenakshi Sharma, task force members, experts, PI, Dr. Swarna Aladi, and all the other co-PIs. I welcome you all for this release of ICMR Neurocognitive Toolbox today. India is currently undergoing through a phase of demographic transition, wherein the aged population is rapidly growing. The life expectancy in India has almost doubled from 36 years in 1960s to 69 years in 2015 to 2020. The last census in 2011 had shown that the elderly population of India accounted about 104 million compared to 5.6 million in 1961. Dementia is a growing problem in the elderly population in our country. The prevalence from various studies is about 20 per 1,000 population, which is an underestimate. And in addition, the prevalence of stroke is also very high in India. In some rural regions in our country, it is more than 550 per 1 lakh population. Stroke is a major cause of vascular cognitive impairment, but dementia as well as the vascular cognitive impairment is undiagnosed in our population. There are many reasons, as mentioned by Dr. Dhaliwal and Dr. Meenakshi, lack of awareness about dementia, limited availability of diagnostic tools, and also scarcity of skilled professionals specialized in dementia diagnosis. In addition, there are other barriers like education levels, languages, and lack of standardization are some of the challenges in diagnosing dementia. However, early screening and diagnosis are crucial in the treatment and prevention of dementia. I sincerely thank Dr. Bhargava for supporting this important multicentric project. This is a collective effort of a great team led by Dr. Swarna Aladi, the PI, the other co-PIs, the neurologists, neuropsychologists, speech language pathologists to develop a culturally, educationally, and linguistically relevant neurocognitive toolbox. I acknowledge the support rendered by Dr. R.S. Daliwal and Dr. Meenakshi Sharma. I'm highly confident that this neurocognitive toolbox will pave way for early diagnosis and treatment of dementia in our nation. Thank you.
Anna to say some few words about this battery.
On behalf of the Indian Council of Medical Research Consortium, we would like to extend our deep gratitude to Professor Bhargava, Dr. Dhaliwal, Dr. Meenakshi Sharma, and the ICMR team for making this launch possible. We are very grateful to the Indian Council of Medical Research Task Force members, Dr. Chopra, Dr. S.K. Das, Professor Gauri Devi, who actually initiated this project. And we are very grateful to the people who participated in the study, the more than 1,500 healthy people, elderly people, people with mild cognitive impairment, dementia, their carers who unhesitatingly participated, all the field workers who actually collected the information from people, and we are grateful to all of them and thank them on behalf of the entire group of principal investigators, co-investigators, researchers. When people come to us with dementia, they have mild memory problems, they have problems in speaking, they have problems finding their place, they have behavioral problems. So to make a diagnosis of dementia, we really need to have the tools that can actually identify them early. This is the theme of the World Alzheimer's Month. No dementia, no Alzheimer's. Diagnosis continues to be a problem. I would also like to acknowledge the help of our institution administrators, directors of our institutions, and all the staff that helped us do this project. Dr. Meenakshi Sharma, without you, this would not have been possible. Professor Kaul, who helped us right from the beginning, you have given us a lot of support, so we're very grateful to you. This has, as I mentioned, tests for diagnosing dementia in 5 Indian languages, but I must mention this is only version 1.0, but ICMR has to be congratulated because 8 years back, they realized that it's important to do research and to harmonize efforts across the world. There are people in this group here who are part of many international consortia. The world is also waking up to say that we have to work with diverse populations, people who are low literate, people with other languages, not just English speaking Western populations. And I think here ICMR has shown leadership, and we have been ahead of the rest of the world in actually trying to harmonize diverse efforts. There is a lot of work left to be done. We request all of you to disseminate this battery, use it, and we hope to develop version 2.0, where we involve people with low literacy, other Indian languages, and then narrow the treatment gap for persons with dementia. Thank you very much.
Thank you, Dr. Suvarna, for the brief introduction. May I now request Dr. Bhargava, Director General ICMR, to release.
Welcome to the launch of the Indian Council of Medical Research Neurocognitive Toolbox. Dementia is a major public health challenge, and over 55 million people live with dementia worldwide. It is estimated that in India, there are around 5.3 million people living with dementia, and these numbers are only expected to rise. Unfortunately, however, majority of persons with dementia are not diagnosed. This is because of low awareness and the lack of standardized tools to diagnose dementia in people who speak so many different languages and who have varying levels of education. Dementia refers to a group of brain disorders that progressively cause a loss of memory, thinking, language, and behavior and affect the ability of a person to function independently. It's typically a disorder of older people, but it can sometimes affect middle-aged people as well. Alzheimer's disease is the most common cause of dementia, but with a high burden of diabetes and hypertension in our country, vascular dementia is also very common, along with other neurodegenerative diseases, nutritional deficiencies, and infections. An early and accurate diagnosis of dementia is very helpful to manage people, to rehabilitate them, and to slow down progression of disease. But we need reliable diagnostic tools to diagnose dementia in countries like India, where there is a high degree of cultural variability and linguistic diversity. Therefore, in a pioneering effort, the Indian Council of Medical Research commissioned a large multidisciplinary group of experts who collaborated on the development, adaptation, and validation of a culturally appropriate cognitive test battery, the Indian Council of Medical Research Neurocognitive Toolbox, that has now been standardized for Hindi, Bengali, Telugu, Kannada, and Malayalam.
English
A wide range of cognitive tests are included in the battery that assess different cognitive functions. For attention, we have the trail-making test. Memory is evaluated using the verbal learning test and the TNI-93. Language functions are assessed using the picture naming test. Aphasia, a disorder of language, can be identified using the Indian adapted version of the FAST. And visuospatial skills are evaluated by the modified Taylor complex figure test. In addition, several behavioral problems that occur in dementia can be detected using standardized questionnaires. The ICMR Neurocognitive Toolbox has shown high sensitivity and specificity to diagnose dementia and its milder form, mild cognitive impairment. The ICMR Neurocognitive Toolbox is available in the public domain for clinical use and research. This can be administered by trained clinicians, and training and certification is provided by the Indian Council of Medical Research. So a large group of people in academic institutions, clinicians, doctors, psychologists, with the able support and guidance of chairpersons and the ICMR task force, were instrumental in developing the ICMR Neurocognitive Toolbox.
Now,
thank you so much. Dr. Dhaliwal, Dr. Meenakshi Sharma, Professor Pandian, Dr. Suvarna Aladi, other investigators from different centers, friends, ladies and gentlemen, directors from other institutes. It's a great day for ICMR today for launching this neurocognitive toolbox in 5 different languages and English language for assessing the dementia. Dementia, as has been brought about, is a very undiagnosed problem because of one is, as has been said, lack of awareness. Number 2 is lack of correct screening toolbox or a lack of a correct test method for doing it. And third is denial. I would say denial is also another important factor where people are not ready to accept it, that this dementia could occur in their family members or themselves. And like any bad news, which goes through the 5 phases of denial, aggression, bargaining, depression, and final acceptance. So these are the 5 phases for any bad news that any human mind goes through. Similarly, this also starts with denial, and therefore diagnosing this problem is vitally important. The second point that I want to emphasize on is that at the time of independence, the life expectancy in India was about 35 years age, and today it has doubled to 70 years. So after 75 years of independence, our life expectancy is 70 years. And therefore, as we tend to go older, we have more with the various risk factors like diabetes, hypertension, dyslipidemia. We are having what is called as vasculopathy. And this vasculopathy is affecting all the target organs, whether it be the heart, the brain, the kidneys, or the eyes. And therefore, the brain being one of the most important target organ of our body, which is the control room or the control center, is highly important that that vascular effects, which are, if diagnosed earlier, should be prevented. And therefore, this tool will be playing a very important role in assessing how and how much of vascular effects are there in how early this dementia is, in what stage it is, and therefore intervention or treatments or rehabilitation can be proposed accordingly. I congratulate the various sites, which is All India Institute of Medical Sciences, New Delhi, Apollo Hospitals, Calcutta, Nizam's Institute, Hyderabad, National Institute of Mental Health and Neurosciences, Bangalore, which has been where we have the PI, Manipal Hospitals, Bangalore, and Jawaharlal Nehru Medical College, Belgaum, Sri Chitra Institute of Medical Sciences and Technology, Trivandrum. Their contribution has been phenomenal, and I congratulate you all, and I'm grateful to you all. Not only is ICMR grateful, but India is grateful to you for developing this tool, which is going to be a major resource for all neurologists, psychologists, speech language pathologists, and general physicians who are, as well as family members who are going to be able to help in the diagnosis of this dreaded disease of dementia. We know that India is contributing to 10% of the dementia cases across the world, and the problem is exponentially increasing as aging is increasing, as lifestyle-related diseases are increasing. So we are finding more and more of dementia occurring in India. And the tools that have been devised for attention, for memory, for aphasia, in different languages like Hindi, Bengali, Telugu, Malayalam will be very useful. And I would request, as the principal investigator has said, that they're working on the version 2.0. I would also emphasize that version 1.0 should be utilized to its maximum. And the very fact that it is going to be available free of cost across for clinicians and researchers of the country speaks volumes of the contribution of all the researchers, all the people involved in this. And congratulations to everyone, and long live India. Thank you so much.
For the very encouraging words. Sir, I must tell you that we are getting requests from several researchers for using this battery. And that was the reason we thought that it's high time that we should put it on our website so that it's freely available to them. The only concern which the neurologists and neuropsychologists have, they are asking that there should be a training module also, and they will be adding that to this module. So with these words, may I now request Dr. Suvarna to moderate the panel discussion? Just 2 or 3 questions, please.
Thank you very much. So I would like to mention that this toolbox has been derived from efforts that have already happened in the country: the NIMHANS neuropsychological battery, the PGI battery, the AIMS neuropsychological battery, and international efforts. So my question to Dr. Manjari, who is one of the PIs from AIMS, is how do you think this new toolbox will help diagnose dementia in the country? What do you see as its future? You're muted, Manjari.
Yes, of course. We know that the diagnosis of dementia is a clinical diagnosis. Now, there is a subjectivity involved in that it is to be taken from the caregiver and has to be a reliable caregiver. However, to make this objective and give it scores and give us confidence in the diagnosis, we need objective tools. And these tools so far, prior to these efforts, were only the Western tools which were available to us. They were not validated for our languages, for our culture, for our education, and for our people's understanding. Hence, this mammoth effort of bringing together so many languages, validating certain international tools, as well as indigenously making modifications to be culturally appropriate for India, will help us objectivize the diagnosis and give us confidence of not erring in the diagnosis. Because if we wrongly diagnose dementia, it has huge and ominous implications for patients and their caregivers. So the correct diagnosis with the correct tools, with the correct scoring will propel us not only clinically, but also research-wise to walk shoulder to shoulder with multiple as well as unified research and harmonized research within the country.
Thank you, Dr. Manjari. Dr. Gauri Iyer was the research associate who coordinated the entire project in its inception, worked with all the centers. She's also, so I'd like to ask Dr. Gauri, what were the challenges when we tried to adapt internationally developed tools? And can you give us some kind of understanding of how this process of adaptation happened?
Yeah. Good morning, everybody. So I think as Suvarna asked, it has been a long, drawn, challenging, but a steep learning curve for all of us in the team, and ultimately a very rewarding process. Because I think the initial instructions or the aim of this project was to make the entire battery in the public available in the public domain. Given that we were working with that set of, that was the aim of the developing this toolbox. So selecting a bunch of tests which met these criteria and where the permissions, where the test developers were allowing us to make these tests available in the public domain was challenging. So using tests where the test developers gave us permissions and allowed us to use it for clinical and research purposes, and where the copyright issues were problematic, we had to look for equivalent alternative tests and validate them or adapt them to the Indian context. And all this was done in a very systematic, scientifically rigorous process, which we are very proud of for a cross-cultural research. And to give you an example of one of the adaptations that we've done is where we actually had the test developers approve the end product is the example of a FAST, which is the screening test for aphasia, and where the initial drawing that was used in the original test was not culturally appropriate for the Indian context. So what we did was actually use a local artist to develop this picture and modify elements of the picture to make it more culturally appropriate, got the original test developers permission and approval of the end product, and then validated it across the populations in India. So this is just one example, and this was done for several tests. And ultimately, the aim was to have this all available in the public domain across the 5 languages. But like Dr. Suvarna said, it's version 1.0, and we are looking to kind of work towards adapting it and translating into several other languages.
Thank you, Gauri. A message, Dr. Avanti, we have actually been able to get some kind of international acceptance of the battery. We already have 5 publications in fairly good journals, which have been peer-reviewed by international researchers as well. So Dr. Avanti has worked hard on this. She's a speech and language pathologist. Any message to how will it help people with language disorders? Aphasia.
Hi, good morning, everyone. So we have a few tests to assess language abilities, mainly the picture naming test and the Frenchy aphasia screening test that Gauri just mentioned. So we can use these tests to assess the language disturbances of individuals with aphasia. We can use them for diagnosis to understand what type of aphasia they have, whether it is fluent or non-fluent, to monitor whether the therapy is working or not. Because we have in the picture naming test, we have pictures of various frequency. So we can use these tests to monitor the therapy, and it can also be used for research as well.
Thank you. Dr. Amitabh Ghosh, any thoughts about how it can be used in the busy clinic for neurologists and for more research? What kind of research do you think dementia India has to do in the future, and how is this battery going to help in future research and care? You're muted, Dr. Ghosh.
Yeah, thank you very much, Suvarna. So yes, I mean, it's an extremely important question to ask, because currently what the world is going to is to diagnose dementia and Alzheimer's disease in particular as early as possible. Because we know that as of now, we just have only one new drug which is developed for Alzheimer's disease very, very recently. So there are many more in the pipeline, but all of these are for early dementias or mild cognitive impairment. So by the time it's too late, the drugs won't help. So essentially, the aim of our diagnosis should be to do it as early as possible. I think the battery that we have, as it will be exposed to more and more researchers, and there'll be more and more research, we will get more and more replies and answers to these questions. How early we can diagnose, we can use this. So that is number one. As far as clinical use in the clinic, another very practical question. I think we have a small version of this test as well that will I'm sure will be made available to everyone, and that version is the version which is exclusively meant for busy neurologists and clinicians and psychiatrists to use in the clinic. So we have that.
Thank you, Dr. Ghosh. A final question to Dr. Jwala. How will it help in rehabilitation of people? I think this will be our last question.
So I think, when we plan someone's rehabilitation, we usually do an assessment to see what their cognitive strengths and weaknesses are. So the battery has a range of cognitive tests, so this should help us plan rehabilitation for them.
Right. So it also is going to help in diagnosis and management. And so with that, I think we are available for any questions in the future. Thank you, Dr. Meenakshi Sharma, Dr. Balram Bhargava, and the entire ICMR team for being so supportive. The task force, like Dr. Anand Krishnan, Dr. N.K. Arora, Dr. Pandian, who kept doing track correction right through the last few years. Thank you so much. And hand over to Dr. Meenakshi Sharma.
Thank you so much. Before Dr. Meenakshi proposes a word of thanks, I would like to really thank everyone that this tool is going to be very important. And we were just discussing what is the Hindi name for dementia, for dementia, and it was difficult to find. And then we found Manobhransh as the Hindi name for dementia. So I would like you to think of some acronym for this toolbox, for this tool, so that it becomes easily accessible to everyone, maybe in a few days, and it becomes simple. And then when you launch it and put it on the Twitter handle today, it may be wise to keep it more neurocognitive is not a layman's word. So it may be wise to use some layman's word. Something like Alzheimer's dementia diagnosis indigenous cognitive tool, which could be ADDICT, or something like that. Some simple acronym which could be simplified, and that may be wise to use. Obviously, ADDICT would not be right. Something similar, ADDICT or ITAD or ADDIT or something like that, or something. So Alzheimer's dementia diagnosis tool, and that could be for the layman's language, because neurocognitive is fine for biologists and medical personnel and research personnel. So congratulations again, and I would request Dr. Meenakshi to please go ahead.
Let me let me start with the process. This process was very difficult one. So I remember that it was not very easy to develop these tests in India. And the first time the neurologists and psychologists, they have come together for developing this test. And that's a milestone for us. So thanks a lot, the chairpersons, the former chairpersons, late Dr. J.S. Chopra, who envisioned this project, and then taken over by Dr. S.K. Das, the famous neurologist who did the Kolkata longitudinal study on stroke. And so he was leading this. We lost both of them. Then we had a young person, Dr. Jairaj Pandyan, who really helped us out with the final version of the tool. Thank you, everyone. We needed constant guidance actually in this area. We were all new to this area. So we got people from other areas also involved. Dr. N.K. Arora and Dr. Anand, they were really mentors in this project. They helped us out in number of batteries, in understanding that how we should proceed with the test. Finally, I think these in all task force members, they have suggested that we should go for a battery for illiterate population too, and we'll be working on that. So they have already submitted a project. We are reviewing. This is in final stages of review. So that's another thing which we are doing. The investigators from different institutes, you have been a strength for us. You are the ones who have been working day and night on this tool. And this was something which was out of box kind of idea. The advisor, Dr. Gauri Devi, she was the one who brought Dr. Suvarna first time to us. And in overnight, we wrote a concept note. And finally, we were able to start in this particular area in which hardly any work was being done in India. So I also thank all the neurologists and neuropsychologists who are attending this particular session. So they are the ones who are going to use. We assure support from our side also, not only in understanding these tests, but in providing research projects too. We will be supporting those projects once they are satisfactorily reviewed by our committees. So I also thank all the NCT scientists, the NCT staff with me, who have been there for, who have been a big support to us. The finance department needs to be thanked because we required so many continuous changes in the budget, which they have thankfully done for us. So I also thank the press team, the online team. Dr. Lokesh has been with us for the last 5 or 7 days. So regularly we have been interacting and coming up with Twitters and the release video too. Dr. Rajnikant also has helped us out. Dr. Harpreet from the bioinformatics team, he was and and Mr. Neeraj actually, who is with the online team. So they helped us in putting the manual. So we had to make some changes overnight. So yesterday only they did the changes and put it on the website. I think that's commendable. So that's a work. The team, all teams, everyone has supported us. Thank you, everyone. Thank you, the NCT staff. Thank you, Director General, for the support. We had 3 Director Generals during this period. And I will vouch that from everyone we got the support. And Sir has been very supportive. He has been encouraging to do it very fast. I think that's the challenge we have to stand up to now. Thank you, sir. Thank you very much. So may I ask people sitting over here to join us for a cup of tea? Sorry, we cannot provide you tea because this is online. Sorry, I'm very sorry for that.
Okay, thank you.
Thank you very much. Thanks. Thanks.
To everyone.
Thank you so much.